Hello, you've been diagnosed with a peripheral artery aneurysm in the popliteal artery. An aneurysm in general means that you have a ballooning out of the blood vessel, and in general the popliteal artery is about maybe a half a centimeter to 1 centimeter in diameter. That's a little bit less than a half an inch, and when it gets to twice that diameter is when we should fix it. Now, the reasons for fixing aneurysms is 3 general reasons. One is they can rupture or burst and bleed. The second is they can develop so much debris or clot within them that they clot off completely and there's no blood going through them to the feet. And lastly, a piece of that clot can embolize or spit down distally into the legs and threaten the circulation of the toes or the calf muscles. So for all those reasons, this should be attended to. In general, we don't fix popliteal artery aneurysms until they get to about 2 centimeters in diameter. That's just a little bit less than an inch. And when it gets to that point, the risk of the problem outweighs the risk of the treatment, and so we recommend treatment. When we don't have to operate, we tend to follow these with ultrasounds until it gets to that point. Once it reaches that point, the evaluation involves an angiogram, which is an X-ray of the arteries, to see what options we have available. And what we're looking for is the extent of the aneurysm and what kind of reconstruction we need to do. There's 2 ways to reconstruct this artery. In general, what we try and do is take that artery out of the circulation and bypass around it with either a synthetic graft or usually a vein graft, one of your own veins. And the results of that are very good. The chance of that staying open at 10 years is over 80%, and patients do very well with this. The hospital stay for this involves about 3 days to a week stay at the most. And people get up and they're walking, we get physical therapy, and we get you going pretty quickly back to your lifestyle.
That's awesome.
After your procedure to fix the popliteal artery aneurysm, we'll have you come back in about 2 weeks to the office, and at that time we'll check the wound. We'll remove any sutures or staples that are keeping the wound in place. And at that point, we'll assess that, have you come back in 3 to 6 months afterwards, and every 6 months to follow the progress of the bypass. And that'll involve an ultrasound and us examining your legs. The important thing to know is that popliteal artery aneurysms, at least 50% of the time, happen in the other leg and are associated with aortic aneurysms. So it's very important for us as vascular specialists to keep on track of that and to make sure that you don't develop those problems and to treat them if that's necessary.